Minister, I want to ask if you will act on the urgent need to upgrade and extend the building from which the Gertrude family practice in County Sligo operates. I visited the practice 2 weeks ago, run by Dr. Helen Fitzsimons, who was actually awarded Rural Practice of the Year 2024. But I saw at first hand the really urgent need to upgrade that building. And very sadly, Minister, I also want to extend my most sincere sympathy to Dr. Fitzsimons and her children on the sudden death last week of their beloved husband and father, Tom Bradley. May he rest in peace.
Margaret Arnott.
Thank you very much. Can I join in offering my sincere condolences to Dr. Fitzsimons and her children and the entire family on their recent bereavement. The Gertine Health Centre, as you'll be aware, Deputy, is located in South Sligo. The centre houses public health nursing, day centre for older persons, as well as the local GP practice, obviously. The local HSE primary care management have advised that they're aware of the issue of restricted space within the building of the GP practice. Whilst it's not possible to extend the building, the HSE is conducting an options appraisal to scope out options for the reconfiguration and the refurbishment of the building. It's intended that the process will be completed in the coming weeks, and following appropriate discussions with stakeholders, a priority submission for capital funding is to be put forward. So I guess that's a long official way of saying, Deputy, that the HSE is aware of this. They are looking to solve the problem. They're going to be coming up with, they're going to be finalising some options in a matter of weeks, which I think is very welcome to hear. And then they will be prioritising whatever the preferred option is. And I want to thank you for raising it, and I'll ask my officials in the HSE to keep you updated on progress.
Thank you for that, Minister. I'm pleased to hear that the process will be completed in the coming weeks, and, as you said, a priority application for capital funding has been put forward. Because, Minister, when I visited the practice 2 weeks ago, I could see for myself the urgent need to upgrade the building. The reception area, for example, it's tiny, it's cramped. 3 receptions. There are wires trailing over sinks. It doubles as a kitchenette, a storage area. There's holes in the floor. The building is unsafe. And yet that practice sees between 4,000 and 5,000 patients. That's the size of the practice. So it's a huge practice. But, Minister, the most crucial issue, and this it's pretty disgusting, but it's the fact that the wastewater system is malfunctioning. I'm told that staff have to come in nearly an hour before the practice opens in the morning, run the taps, flush the toilets, open the windows continuously so that people can come in an hour later. So you will hear from what I'm saying, the urgency in this matter.
Yeah, thanks very much, Deputy. It's very clear that there's urgent remediation required, and it is welcome that the HSE believes they'll have conducted the assessments and they'll be back in a couple of weeks. There is important additional good news for the area. The planned primary care centre in nearby Tubbercurry is due to commence building early next year, which I know will be very, very welcome. The existing primary and mental health care centre in Ballymote is to provide the majority of HSE primary care services in the area, and it's intended that this will allow for the reconfiguration and the refurbishment of the Gertine Health Centre for all of the very pressing reasons that you have articulated today.
Tubbercurry, Ballymote, people will be very pleased with that. But what's at issue here is the Gertrude Health Centre. And I do want to say that they told me that the HSE maintenance manager has been as helpful as he can. He's done everything he can, but the problem is a severe one, and you're just papering over the cracks. One final point, Minister. I know you're really interested in women's health, and Dr. Fitzsimons runs a Well Woman clinic 2 days a month in Manorhamilton, and many, many patients come to her clinic for women's health issues, specifically in Gertrude. That's one of the reasons why she and her brilliant staff are so busy. It's a really important service, and we must ensure that the building in which that service is being provided is up to standard. I'm pleased with your response, and I look forward to working with you and your officials to progress this matter.
Yeah, thanks very much, Deputy. And can I just acknowledge the work of Dr. Fitzsimons on women's health? I was delighted earlier this week, to be able to expand that. This will be our 5th budget in a row where we really do prioritise women's health care. There have been a few important additions which Dr. Fitzsimons will, and all the other GPs will be aware of and will be part of. One is the expansion of IVF eligibility. I know that's going to be is going to make a lot of difference to a lot of couples. And the first step on that fertility journey, obviously, is with the GP. It's they who refer into the 6 regional centres, who then refer on for IVF. HRT has been made free. This has been very, very welcomed around the country, and the medical profession, the GPs, are saying, look, this is great because it removes barriers. I was talking to one lady in Wicklow yesterday who said she's spending €1,000 a year on HRT. So I just want to commend Dr. Fitzsimons and indeed all of our GPs around the country for their real championing of the women's health priorities over the last number of years. Thank you.